presentation moving forward. The first is, who are their people? Their meaning the children. Do we know their people? Have we found their people? Do we know their people? I repeated myself. The second, who's making the decisions on behalf of this young person? Being really intentional and mindful about that. And third, what is the process that we're using to make decisions and to engage the people? So those are the three questions. Who are their people? Who's making decisions? And what's the process? So the title of this presentation is Placement Options for MSY Youth. And I just want to start off by recognizing that placements are in need of systems. I have been doing this work for about 20 years, and never once, not a single time, have I heard a young person, a youth, or a family talk about their need for placement. It's just not the lens through which they view their needs and their lives. So I think it's really, really critical that we recognize that we're trying to get our system need met when we talk about placements. Children and families need relationships. And the unfortunate reality is many times when we approach our work through the lens of getting our need for placement met, there's an unintended consequence of disrupting or not addressing the need for strengthening and healing relationships. And so I point this out early because it's a tension that exists as we try to meet our needs while simultaneously meeting the needs of our children and families. I'm a very firm believer in what you focus on has a higher likelihood of growing, right? I'm gonna say it again just because it's really important to me. What you focus on has a higher likelihood of growing. And so just to go back for a moment, if we focus all of our time on placements, finding the best one, maintaining them, developing them, then that's what will grow. We will further develop a system that is focused on placements, maintaining placements. If we focus on relationships and healing and network development, then those will grow. And one of the primary lessons that I've learned in my work for youth who are involved in multiple systems is that if you focus on relationships and healing, 99% of the time, the placement will take care of itself. And so really just being intentional and mindful about where we focus our time and our energy and how we work towards accomplishing the goals that we have. So family finding or family seeing is a philosophy, it's an approach, it's a lens through which I view all of my work. And I'm going to show you three driving forces. These are from a friend and colleague and mentor of mine by the name of Kevin Campbell, who is actually the model author of Family Finding, who helps us to recognize that human connection is required for healing, restoring, and building health and development. And that safety is temporary without healing. And I want to just sit with that statement for a moment, that we have young people who are at great risk when it comes to safety, many times to themselves and to others. And that when we work to address solely the safety issues, oftentimes physical safety and not necessarily emotional or relational safety, that it's temporary. And that temporary nature can create a loop that I'm sure many of us on this call here today feel like we're stuck in, that we're constantly seeking a physical safe place for this young person. And I find that that's often because we do so in the absence of a structured, intentional healing process. The second is that investigations that tell only the story of the harm and its consequences, which result in dismembering practices of families, siblings, culture, and community, they reduce the opportunity for recovery, resulting in suffering and moral injury for all involved. And when I read that statement, I think about the lens, again, through which we focus our energy around very real trauma, very real harm, and very real consequences in the form of behaviors, antisocial behavior, really significant struggles. But when we focus solely on those stories of harm and its consequences, we miss the opportunity for recovery, and inadvertently often create additional suffering and moral injury. And then the third and final driving force behind family finding is we can see, or we can learn to see, the vast stores of human capabilities within people, families, communities, and culture, acting not to solve social problems for people with services, treatment, and so-called models, but to support families and young people to create livable lives with self-determination and dignity. And my takeaway from that statement is that ultimately, with all these words on the paper, it's the families and children who do the work, and that we have to view within them the inherent capability to do that work and our roles as facilitators and conveners. So I'm sure many of you have heard this statement before: this child has no one. And I want to challenge you to recognize sort of a truth when you hear that statement moving forward. The first hypothesis is either they physically don't exist. When you hear someone say this child has no one, or you say it, because I've said it, that they physically don't exist. The other option is that they don't have value. And that value is based on our needs. So I'm going to show you today definitively that they exist. I'm positive. But really recognizing that in that statement of they don't have value, it's that their value is often determined by their ability to meet our need, usually for placement. And so, for example, there's a program in Ohio, many of you or some of you might be aware of it, called 30 Days to Family. And when a child first enters foster care and no kin can be found for placement, that 30 Days to Family team works to identify and build the network, focusing on relationships and connections. And this number 5 represents the average number for a non-30 Days to Family case of connections that make their way into SACWIS, our state database, in the first month that a child is in foster care. And the reason for that is, the reason that number is so low is that we often look for connections through the lens of placement. We have a crisis. The family situation has resulted in a significant enough crisis that a government agency has stepped in and removed the child. And we make phone calls to say, can you take this child? Usually once we get to about 5, if we can find 5 names, we stop and move towards traditional foster care. The reason I'm showing this is 30 Days to Family, on average, during the first month that a child is in care, is finding 194 connections for children through family search and engagement. Our high water mark is a child in Fairfield County, where we found 556 connections in the first month of their time in care. I don't have time here today to get into the program and how it accomplishes this. My point in bringing this up, if I could go back for a moment, is on the left. They physically exist. I promise you, this child has people. And even for kids who've been in foster care for 7, 8, 9 years, 10 years, or involved in multiple DYS and other systems where they've been separated from their family, those 194 on average still exist. Those people can be found, and when given an opportunity, they can contribute to the solution. So belief is defined as trust, faith, or confidence in someone or something. And what I would challenge all of us to I guess, cultivate and recognize within ourselves is, do we believe this child has people? Secondarily, do we believe that families are the experts in their own lives? Do we believe that people change, people grow, and people evolve? And do we believe that when given access, power, control, and resources, families and natural networks can solve the challenges they face? And do we believe our job is to catalyze, convene, and facilitate? Because if we do, and we reflect on our experience and we recognize we cannot fix traumatized children and then engage the family and network. It doesn't work that way. I guess I want to pause for a moment and just say it again differently. If we recognize that family and connection and belonging and identity and safety are provided by the network, then we recognize that the healing process is in and of itself the development of that network and the family's ability to care for their children. So to the second question, who's making decisions and how? Where are meetings being held? For me, it's always really jarring when I attend a meeting with family or with a network or with a community on behalf of a child, and the family has to go through a metal detector to attend the meeting in a large, intimidating building. And recognizing that the influence on power and control and access when we're in those meetings, in those settings. Another thing to point out about how decisions are made and who's making them is, do we have dynamics where there's 2 family or network members for every 1 paid professional in the room? And does the young person and the family know who's paid to be there and who's not? Because those power dynamics also influence a community and a network's willingness to make themselves vulnerable and contribute to the solution. Do we have consistent and skilled facilitation of a process that creates reliability and trust amongst those who can and should be the ones driving the solution? Because if we don't, we lose trust when network members come to meetings believing they're going to be able to contribute only to have the process itself change without their knowledge. And then finally, do we have transparency with an outcomes-driven process? Are we focused not on the child's behaviors and fixing them, but on cultivating the family and network's ability to solve the challenges that the child and the community faces? So I want to highlight 3 tools that you can take away today as you explore how to use this family and network capacity building process as a method for addressing our system need for placement. The first is an eco map, which is based on mapping out not just biological and community and fictive kin relationships, but also agencies and service providers, and having the young person themselves and or their caregivers and their network map out the strength of those relationships and identify within that eco map opportunities for those strengths to be leveraged in the planning process, as well as places that need additional development and strengthening. This is a tool that can be used in real time as a platform for addressing crisis level placement needs by bringing and centering around not just the strengths, but the opportunities for improved engagement and in healing. The second is called a placement trail. It breaks my heart when I meet with a young person and learn that they've had 40, 45, 50 placements in their 10 years in foster care or 10 years in other systems, and only to perpetuate the belief that when things get hard, you're asked to leave, notice is put in. As a side note, no teenager should ever know that what the phrase 30-day notice or 7-day notice or 14-day notice means, but the reality is our kids do. They hear that phrase. But going back and teaching our young people or facilitating on behalf of our young people what healing looks like in real time by making phone calls and apologizing, asking others to apologize, asking for re-engagement, being willing to say to a foster parent that was 7 placements ago, you still have meaning to me and I want to visit with you on weekends. I would love a birthday card from you. Learning how to strengthen and maintain relationships can be done through placement trails. Many times our young people don't even have the ability to recall the places they've lived and the people that had meaning to them. So it's not just the place that they lived, but it's also the community and the network that surrounded that placement that has an opportunity for engagement. We often are fearful as professionals as well, before I move on, that we will re-traumatize children by going back and revisiting places that, air quote, let them down, when the reality is that what we're showing to them is that sometimes relationships are hard, and going back and mending and healing them is a skill that will lead to the solution to the challenge that you face right now. And the third and final tool is a genogram. The reality is that our kids often define who they are and who they can become based on the dysfunction that was their nuclear family or their immediate environment. And creating a genogram with a youth helps them to tell a story beyond just their eyesight right now, to help them see that they may have doctors, clinicians, teachers, just like many of us on this call today, within their family or other professions or other lives outside of just the dysfunction that they've seen. And learning who you are on a larger scale than just your immediate surroundings helps them to begin to broaden who they could be, and also the support network for who can contribute to the solution. I want to wrap my time, because I don't think I went terribly over. Kudos to me. With a quick 30 to 45-second story about Roz, because if I'm guessing, some of you on the call or on this session may be thinking, this is a great framework, but probably not for the level of child that we typically work with. So Roz was 14 years old when I met her. She had been in foster care for 7 years. She had diverse SOGI, was incredibly unique and talented, but also very angry. She was in the highest level of residential treatment, had been bounced around from several residential treatment facilities prior, was angry, was breaking things often in solitude, was being kicked out of her special education school due to violence against a teacher, and was really disconnected and heavily medicated. When we met her, we began a youth-centered permanency planning and relationship development process that lasted a little over 12 months, that brought her biological mother, her siblings, her aunt, her 2 mentors, her Wendy's Wonderful Kids recruiter, her second cousin, all to the table over the course of structured processes that were led by her and the family that outnumbered the professionals in the room. And after 12 months of work, and by identifying that her biological father had never met her and didn't know she existed, he came to the table, and despite some of the challenges and barriers he faced, she was able to step down from residential treatment into a placement, right? Our need for placement with her father. And the healing process still continues to this day, as she begins to learn what it means to live within a permanent family setting. So my point is, on paper, she was as multi-system youth as it gets, and this process works with even the most challenging children. So with that, I will leave you with a couple of quick statements. One, belief is the birthplace. Do we believe our families are capable? Who are their people? Who's making decisions? And what processes are we using? And then my very final statement, I promise, is this is a poster that I recently developed that is hanging in my office, that I encourage all of you to print and hang in your office, because 99% of the time, I know that's the second time I've said 99% of the time, but we didn't ask the kid and we didn't ask the family. So it's a good reminder that we're making a whole bunch of decisions to meet our needs without stopping and asking the kid who their people are and how we can better engage them. With that, I will say thank you and field any questions in the short time we have.